Attitudes towards mental health are improving on the whole, but a new survey by the National Council of Social Services shows that 1 in 5 find it frightening to think of someone with a mental health condition living in their neighbourhood. Now, that's why the work continues for the mental health movement beyond the label, which will refresh its services.
And our reporter Sherry Locke joins us now in the studio with more. Sherry, as Dawn just mentioned, 1 in 5 finds it frightening to think of someone with a mental health condition living in the neighbourhood. What are the other key takeaways from this study by the National Council of Social Services?
Well, as Dawn mentioned, some very positive results from this survey. So we've seen that, people in general in Singapore, they seem to have a greater understanding of mental health. Obviously, this conversation has been brought to the fore because of the pandemic. And even just covering mental health over the past year or so, I've come to realize how many forms of help, how many counselling services there are out there. And this seems to be something that the survey respondents have noticed as well, with 7 in 10 now believing that people can make a full recovery from mental health conditions. There also seems to be greater awareness that mental health issues don't just affect a small segment of the population, but can be quite common. So 4 in 10 are willing to live with people with mental health conditions, and 6 in 10 are willing to work with them. So it seems to be some success on the whole in demystifying mental health.
So, there are positive shifts, but the work continues. More needs to be done on this. What are some of the misconceptions that, are sticking?
Well, so one of the misconceptions that was brought up in this survey is that 1 in 4, they believe that the main cause or one of the main causes of mental health conditions is the lack of self-discipline and the lack of willpower. So this is quite a dangerous misconception, and distrust also seems to persist. So 1 in 5 said that they don't want to live with someone with mental health conditions, and 1 in 4 find it stressful to be co-workers with people like that. So these are both increases from the last time they did this survey in 2017. So it seems like that part of the population that feels quite strongly about being around people with mental health has gotten a bit larger, according to this survey. And in the workplaces as well, we've heard a lot about how companies are stressing the importance of mental health, but according to the survey, it doesn't seem like this is translating to tangible benefits for all employees. Only 2 in 5 think that their workplaces provide adequate support for their mental well-being. But with how much we've been talking about creating more sustainable, more caring workplaces in 2022, hopefully this is something that we will see shift again in the next survey.
Sure, of course, a workplace or private organizations, they can offer or they cannot offer as they choose and at what level. But on a national level, what the government can do, what sort of national organizations have we seen coming out? You're on this beat, so you should know what has been happening, the kind of the help they've been giving. If you could very quickly describe that for us.
Well, the most recent development today, the National Council of Social Services, they are refreshing their Beyond the Label movement. So it won't just focus on awareness now, but it'll go beyond that to target these specific groups and the behaviours within them. So we're looking at youth, we're looking at caregivers, we're looking at employers, as we mentioned just now. And they won't just be doing this alone, but they'll bring together 26 partners from all sorts of sectors to target these issues and to sort of address the stigma, encourage more people to seek help, encourage more employers to hire inclusively. So hopefully we will see some change on that front. And on an even broader scale, there's the Task Force for Mental Health, which the government has set up. And they've just concluded gathering feedback, conducting their reviews. So they should be releasing their findings soon. On the education front, no new announcements at this point, but the president did say in her speech today that more needs to be done in terms of educating the public that mental health exists on a spectrum. And so let's see what she had to say.
We should not erroneously associate criminality or violence with mental health conditions, as this is rarely the case. We must encourage early help seeking and intervention so that mental health conditions can be better managed and individuals can thrive despite their condition. We must look out for our loved ones and dispel the shame and stigma of seeking help.
Sherry, we talk about issues like climate change needing to be part of this national conversation. Perhaps mental health needs to as well. What are the things that each of us can do to play our part, as it were?
Well, so the president today also mentioned that we can start with the people around us. So prioritizing our families, our friends, our colleagues, keeping an eye out for them, noticing when something's off, and if they're not coping so well, maybe referring them to professional help. For employees, taking that a step further, they might want to consider organizing peer support workshops for those in the workplaces so that they know how to better support each other. But yeah, of course, I was working on a similar story earlier this week, and the psychologist I was speaking to said that while all of this supporting is very useful, you also need to know kind of where to draw the line. So yeah, he was saying that the key is really learning to differentiate between disorder and the stress. And once it crosses that certain line, you kind of have to refer people, your close ones, to professional help. So I think understanding where we all fit in this mental health ecosystem, that could help Singapore really sharpen its response to mental health in general.
And thank you for coming in to join us and spelling all that out for us. Sherry Locke, our reporter. Thank you.